Level 989.
Welcome to a 989 on Health Extra. These quick supplements should help ease any withdrawal symptoms you may experience while waiting for our next full episode. So, Mike, what's on today's agenda?
Usually our topics are about everyday things that we can all do or not do, to inform our choices and be healthier. But I came across a topic a few weeks ago while doing other research that caught my eye. It's interesting, but probably won't be directly useful for most people. Or will it? The topic is surgical smoke. And me being me, I chuckled a bit when I saw it, picturing an old-fashioned operating room in the 1950s, where everyone in the room is smoking a cigarette, including the patient. Hey, maybe the patient is giving birth. There's a nurse ready with a cute little mini cigarette for the baby as soon as it's born. But it turns out, surprise, surprise, that that's not what surgical smoke is. Before we dive into the medical angle, how about a quick refresher on smoke itself? As I mentioned in episode 50 about burning incense, smoke is a cocktail of airborne particles and gases released when something burns, and the chemical makeup of the smoke will differ based on what's burning. The smoke is going to be teeny pieces of the object that is burning that were only partially burned, as well as airborne ash particles, carbon monoxide, benzene, toxic metals, and more. Now the term surgical smoke sounds pretty specific, right? It would be smoke created during surgery. But what counts as surgery? Well, it won't surprise you to learn that the term surgery is from Latin for handwork. To break it down into the plainest English, surgery would be using hands and instruments to treat a condition, to improve bodily function or appearance. So, technically everything from covering your rosacea with some green-tinted primer to a heart bypass could technically be counted as surgery. But applying some makeup with a brush isn't going to create surgical smoke. To create smoke, some high-energy tools need to be used. We're talking about dental and bone drills, medical saws, lasers, ultrasonic instruments. But you're saying, Mike, how often is someone using a bone drill on me? Well, hopefully not very often. But what about laser hair removal, tattoo removal, varicose vein removal? And don't try to kid me, I know you're in there every other week for varicose vein removal. But seriously, thousands of people every year are getting procedures that create what the National Institutes of Health are calling plume, which is a word I always associate with volcanoes, but sure. To quote the National Institutes of Health, airborne contaminants can form during disruption of tissue cells by heat from lasers, saws, or ultrasonic instruments. This disruption can cause the release of plume, which may contain viable bacteria, viruses, cellular debris, particulates, noxious and toxic aerosols, gases, vapors, or fumes. Additional chemicals can be released when energy-based procedures contact tubing, swabs, and skin preparation solutions. E. coli, staph infection, HPV, HIV, and hepatitis B virus have been found in laser plume. Many different chemicals have also been found in plume, including carbon monoxide, hydrogen sulfide, ammonia, toluene, styrene, phenol, benzyl cyanide, and hydrocyanic acid. So it's not just a little harmless smoke. A lot of different types of cells, chemicals, and critters can become airborne during a procedure as simple as a tattoo removal. Now, don't cancel the appointment to get your tramp stamp lasered off. There are guidelines in place designed to protect patients and practitioners, including something called evacuation, which is not you running out of the building. It's removing the air that might be contaminated and filtering it. This can take a variety of forms, but ideally, there would be tubing that was held very near the site of the work being done, which would vacuum away the air and the particles before the patient or the practitioner can inhale it. So the first thought is that we're all breathing this stuff in, but if your practitioner isn't following proper procedures, you can imagine this plume of gases and particulate matter slowly settling on chairs, tables, and you. So as you come into the room after someone else's service, you might be experiencing a gentle snowfall of their cells sprinkled all over you. And sure, maybe they changed the little paper strip that you sit directly on. But what about everything else in the room that has a light dusting of the last patient's hepatitis on it? You probably think I'm exaggerating for effect. But over at ortoday.com, there's an article on surgical smoke I'll quote from now. a number of hazards that surgical smoke poses to patients. These include a lack of visibility during procedures and delays during the procedure to clear the smoke. Wait, let me restate that. Lack of visibility during procedures. The doctor cannot see because there is too much smoke. They have to stop and wait for the air to clear. That is a lot of smoke. Okay, so the article goes on to say, nurses have twice the incidence of many respiratory problems as the general public, and few doubt that there's a connection between this and their long-term exposure to surgical smoke. Now, I've never had in-depth surgery. I've never even had laser hair removal or tattoo removal either. But in all the pictures I see of these procedures online, everyone's wearing big laser protection sunglasses. But no one in these pictures is wearing a HEPA filter. And HEPA stands for High Efficiency Particulate Arresting. Of course, most of the pics of removals you see online are from the marketing department, all from the "doesn't this look amazing" angle. So putting your supermodel in a big HEPA filter mask would probably defeat the purpose of marketing. But I have to think that a lot of hair removal is upper lip, chin, or other facial hair, and it would be difficult or impossible if the patient was wearing a big, bulky HEPA filter on their face. So what do? Tell you not to breathe? Probably. It was surprising to me that a lot of the articles I read about surgical smoke were a few years old at this point, but there seems to be surprisingly little action and too few new regulations when it comes to protecting practitioners and patients from surgical smoke. There's always a lag when it comes to new safety laws. So here's the part where you can take some action for your health. If you're getting a consultation for a laser treatment or any other high-powered treatment, especially where tissue is being vaporized, procedures that create surgical smoke, be sure to ask your practitioner what their policies and procedures are when it comes to protecting your health. And hey, and the health of patients who might be breathing in your cells a few minutes after you leave the medical office. As always, there are lots of useful links in the show notes. Be sure to check these out for more details. Thanks again to our great listeners for sending in suggestions. If you'd like to send in your own topic for consideration, head on over to level989.com/contact and make it so.
That's all for now. You can find links to read more about today's topics at level989.com. Why not take a moment to rate or review us in iTunes, or give us a mention on social media? We can't help everyone if they don't know we exist. Don't rely on us as an alternative to medical advice from a professional healthcare provider. For the full disclaimer, please see our website. Thanks for listening, and now, go health yourself.